and then unhappy farmers. Well, the union budget for 21-22 was expected to address these big concerns, and there was a lot of anticipation as to what the government would do for both the agriculture sector as well as the health sector. Now, we'll try and focus this episode of Government Matters on these two crucial sectors, and for that I have not one but two domain experts, Remya Nair, who tracks the economy, finance ministry, so everything to do with the budget today, and Abantika Ghosh, who tracks the health ministry for us, and she's been leading our COVID coverage. So do start sending in your questions, but you can also send in questions outside these two areas and spheres. Remya, our expert, is here, so we'll direct most of them to her. So Remya, let's begin with you. Your big takeaways from the budget.
I would say the big takeaways is the mega privatization push that the government has announced. It's a very ambitious plan to exit many sectors completely. So the government is talking about how only 4 strategic sectors will be retained, where there again the government will have only a very minimum presence. So that's one big thing that the government has announced, at least in terms of intent. It's not going to be easy, the fact that the government finance minister has actually said that she'll move to privatize 2 state-owned banks and 1 state-owned general insurance company this fiscal. Privatization of banks, especially state-owned banks, is a very sensitive issue.
Right.
Trade union, the bank unions would be, I'm sure, against it. There will be a lot of political backlash also. So that's a very brave announcement that the FM has made. Obviously, one will have to wait and see how exactly the implementation will happen going forward. So that's a big key takeaway for me. Another is the fact that they have opened up the insurance sector for FDI up to 74%. It's nearly 2 decades after the insurance companies were first private players first entered into the sector. And the interesting part is they're also allowing for foreign ownership and management. So that's a big change in terms of key takeaways. In terms of spending, infrastructure and health seem to be the 2 big priorities in terms of spending.
Right. So Ramya, before I move to health, what has been in store for farmers? Because we know that has been a big bone of contention and a big something that the government has been battling now for a while.
See, in terms of allocations, it's pretty much similar. If you will look at the budget numbers, the allocations are similar or probably a bit lower compared to both BE and RE of last year. So not much in terms of numbers, but the budget speech did spend a lot of time on how, the government has given MSPs and, the whole procurement numbers. There's a lot of support for micro irrigation funds and those kind of support. There's also this whole cleaning up of the books of Food Corporation of India, basically where now the government will actually take it on its books rather than the FCI borrowing from the National Small Savings Fund. But that there's not like a big announcement in the agri sector per se.
Right. Okay. So Abantika, the next big thing, health. We again saw, so as Remya said, there may not have been much in terms of numbers in agriculture, but we did see the FM sort of reach out to farmers and mention what this government has done. What was happening on the health front? Mention of COVID, mention of vaccines.
So again, the numbers are not there. There was, I think, much more space, much more time was given to health than is usual. But in terms of allocation, it's actually quite disappointing, because for the health ministry, which includes the Department of Health and Family Welfare and the Department of Health Research, it's just a 7% hike over last year. And last year, remember, the economy was slowing down. So last year was a 3.75% increase, and this year it's just a 7% increase. So, the two together, they've been allocated 73,931 crore, which is, and last year it was 69,000 crore.
So that 69,000 crore was the budget estimate last year, or was that the revised?
Yeah, the budget estimate last year was 69,000 crore. So budget on budget, BE on BE, the increase is just 7%. Also, see, the Department of Health Research, this year it has really shown why it is so important. For years and years they've been talking about how measly our spend on health research is. And this year, remember, Covaxin started from the Department of Health Research, from the National Institute of Virology, Pune, which is a part of the Department of Health Research. So, and again, they have got like a 500 crore increase. Last year it was 2,100 crore. This year it's 2,663 crore. So, in terms of numbers, it's really poor. And also then there is this Pradhan Mantri Atmanirbhar Swasth Bharat Yojana that has been announced. This is a 64,180 crore, but that allocation is for 6 years, and we don't know how much it will be. On an average, if it's uniform over 6 years, it's just about 10,000 crore per year. But there are many important things that it talks about this under this scheme that they'll do. And one thing that I would really like to mention is this, it, apart from everything else that it plans to do, increasing laboratory infrastructure, basically health system strengthening and all of that, it also talks about support for 17,000 rural and 11,000 urban health and wellness centers. These urban health and wellness centers are a direct fallout of the way COVID covered the country. You know how cities like Bombay, Delhi, Pune, cities we have always thought of cities as places which have much better health infrastructure, which would never run out of beds. But that's where COVID raged. And that is because we did not have boots on the ground to do contact tracing, to go door to door, look for people who had contact history, or generally just the fact that in urban areas we don't have health workers like ASHAs and ANMs. We have paid a very heavy price during the pandemic. Numbers have, touch wood, they have been very well. We have fared very well. But in terms of the spread of the disease, we have seen how much we could have done better if we had these people on the ground. So that is why these urban health and wellness centers that the budget talks about, that is actually very important in the COVID perspective. Other things, the public health units, the public health units at the points of entry, then also strengthening of the National Center for Disease Control.
Right.
Many people did not even know we had an NCDC before the pandemic. So now we are talking about expanding it, strengthening it. So these are direct fallouts of the pandemic. And this is all very good, in terms of statement of intent, it's very good. But from whatever I have seen of the budget, I haven't seen the money really.
Right. So not too much increase in allocation, but intent drawn straight from lessons from the pandemic. Okay, Remya, so let me take this question from Tarush, because this is on agriculture. Should the government get more agriculture reforms like removing subsidies and taxing agricultural income? This has been a debate forever.
I don't think taxing agricultural income will happen anytime in the near future. This debate always comes up during the time of a budget, especially when, say, there's a tax that is imposed on the, the super rich. If there's a tax imposed, then the whole question comes in that India has a very low tax base. We should look to expand the tax base. Only around 5 to 6 crore Indians right now pay taxes and file their returns. Those who pay taxes is even lower. So because, we're such a huge country with such a huge population, this debate has always come in. But no government so far has shown its intent to tax agricultural income, and it's unlikely because, again, it's a politically really difficult decision.
Right. Okay, Tanveer Panjwani, the FM has declared that had declared that this budget would be an extraordinary budget. Do you agree with her? How much will you rate this budget on a scale of 1 to 10? 1 being bad, 10 being extraordinary.
Okay, so I'll definitely not go into the whole rating part of it. But in terms of, it is a big bang budget according to me, specifically because of the measures that they have announced, as I said, on privatization, on the whole FDI bit. They may have, again, there's been this whole push for Atmanirbhar and protection of domestic industry, which could have been avoided because, you're again protecting domestic industry at the cost of consumers, because eventually, levying of customs duties on imports would mean that items are expensive in India.
Right.
So that's something that could have been avoided. But yes, there's been a lot of measures per se in terms of even the whole infrastructure push that is, envisaged. It is, in terms of vision, it is there, it is a big bang budget according to me.
Right. So Abantika, as I mentioned earlier, there was a lot of anticipation on the health front, but you've mentioned that the numbers don't sort of justify the kind of anticipation perhaps that there was. What has been the reaction of industry experts, of doctors on the kind of allocations made?
So the reaction has been mostly positive because it deals with health instead of just one ministry. It deals with health as a bigger entity, clubbing it with air pollution, sanitation, water supply, all of which eventually contribute to your disease numbers and your general level of wellness. And that is how the finance minister really arrived at her estimate that it's a 137% hike.
Right. I wanted to ask you that. So what is the 137% hike?
Right. So the 137% hike basically includes the 35,000 crore for vaccines. That obviously was never there.
Right. So it's a new component.
Yeah, COVID vaccines they were not a part of the budget in any case. So that's a completely new thing.
Component.
Then there is on drinking water, there's 60,000 crore allocation, and this includes sanitation, and then there's also the allocation on air pollution. There's this scheme for voluntary junking of vehicles, old vehicles, so that people move to cleaner fuels. So that is there. So all of that taken together is that estimate of her estimate was, it was 2,23,846 crore. That was her estimate. But that takes into account all of these: liquid waste management, nutrition, everything. Also, the nutrition aspect has been, there have been a lot of positive reviews. Though analysts are also questioning that ultimately, like I mentioned in the beginning, that ultimately where is the money?
Right.
It's such a small increase. For years and years we've been talking about the fact that India needs to spend 2.5% of its GDP on health. So we are nowhere close to that number yet.
Right.
It's about half of that maybe. So yeah, overall it's not a very critical response, but questions are being asked about the financial allocation. Though, to be fair, the finance minister also said on vaccines that if we need more money, I'm open to increasing that allocation.
Right. So, Remya, I'll
just add to that. Of that also 49,000 crores is just on account of the Finance Commission recommendations on health, on grants for for water and sanitation and for health. So that is something that the government is bound to give.
Right. So it's a part of the Finance Commission recommendation.
It is part of the Finance Commission recommendation.
So, Remya, let me flip this question to you, because as Abantika pointed out, there is a question about where is the allocation for health, but then there is also the fiscal deficit to be kept into consideration. So how would you look at the budget from that point of view? Is it a disciplined budget?
See, it is very difficult to term this budget, as in terms of purely looking at from a fiscal deficit point of view. The fiscal deficit for 2021 is budgeted at 9.5%. For next year is at 6.8%. Would you call this fiscal indiscipline? Not really, because last year was
it's an exceptional year. It's been an
exceptional year. Tax revenues were really low. Expenditures increased. In terms of sources of revenue, disinvestment again didn't really, the government wasn't able to meet its targets, and for that matter, not really, they can't really be blamed for that. So but also I will say that the government has made a very conscious attempt to clean up its budget in terms of actually showing the correct fiscal deficit numbers.
Right.
So the finance minister actually mentioned it in a budget speech on how they will ensure that the Food Corporation of India will not borrow from the National Small Savings Fund to fund the food subsidy. So far what happened was, a part of the food subsidy component was financed by the FCI borrowing from NSSF.
Right.
Whereas, ideally it should have been allocated in the budget. So in terms of, when you look at like that, they've actually tried to even clean up the budget.
In fact, this was our next question from Ayla Nanda, who wanted to understand what the food subsidies loan, what the budget meant on that. So I think you've sort of touched upon it.
If you will just look at the food subsidy components, it may not really present a correct picture to you, because what is allocated in the budget, you have to also add what is allocated, what FCI borrows from the NSSF towards meeting this food subsidy. So net probably the food subsidy for 2020-21 would be higher compared to next year. That will be 2021-22, and that's also because the government gave a lot of free food grains right from I think March till November. So there was free food grains and pulses that were given to the vulnerable sections of society to protect them from the pandemic and its ill effects.
Right. Okay, Abantika, the next viewer, that's a question for you, wants to know, so does the fact that there has not been too much allocation for health show that COVID is perhaps on the decline? Are these fair conclusions to draw?
Not really, because see, this is actually I was thinking I should have mentioned this. health, whatever health allocation the center does, there's a 60-40 split in the health spend. So
Right.
states have to do matching
Spending.
They have to spend their share. If suddenly in 1 year, like was being predicted, some obscene 50-60% hike happens, states would be overwhelmed. I don't think they would have had the money to match
it.
their share. So that was fantastic. That could never have happened. States would have had to have really a long notice period and to do that. So which is one of the things that successive health ministers in India have always said, that we are trying to increase health spend, but you have to understand that there is no room for absorption of sudden increase. So I don't think this is related to COVID per se. In fact, if there was a sort of a knee-jerk reaction, massive hike, that would have caused many more, sort of complications down below in the at the actual level of implementation. So I don't think we can really link this to COVID, except for that 35,000 crore specifically for health for COVID vaccines. I don't think there is, and some of the learnings that I said, the statement of intent and all of that, which is very good and which probably we wouldn't have had spelled out in a union budget had it not been for COVID. But otherwise, I don't think you can make a direct link between COVID situation in the country and the health allocation in this budget.
All right. Okay. This question, Ramya, Ayushman Mukherjee, what is your opinion on the bad bank being set up? Is that a correct way to deal with stressed assets?
Opinion varies on how a bad bank will actually be able to handle the bad debts and assets. It will depend to a large extent on the contours of the bad bank. How exactly will the bad banks, the details of it and how it will be set up, who will be the promoters, how will, what kind of rules will apply to this bad bank, will there be any relaxations which are not applicable to say the existing asset reconstruction companies but will be extended to this bad bank. So till the details are not clear, you will really not know how exactly this bad bank will be able to function and take care of the bad debt problem.
Okay, so I'll ask you one last question before I come back to Abantika for her last question, and I'll club all these questions on privatization together. One is from Namra Patel. She says it's a bold budget for the banking sector. Is it the first budget to privatize 2 public sector banks? Then there is a question from White Wolf. Will the disinvestment plan go through, seeing the past records of the Modi government? And then there is a question from Priya Rajesh. What are the implications of this large-scale privatization on the economic welfare of citizens and on India's economy in general? So one, is this the first time that we've seen privatization of 2 banks in one budget?
So the last time, IDBI, the government did announce its intent to bring down its stake in IDBI Bank to less than 51%. IDBI was one of the easier banks to privatize per se, because it's governed by a different act as compared to the other banks which are governed by the Bank Nationalization Act. But again, if you will look at it, what happened eventually was, LIC picked up stake in IDBI. So would you really call that privatization when, a state-owned insurer actually picked up stake in another bank?
Right.
So in those terms, yes. So this is the first big announcement, and the talk of 2 banks would be interesting to see which would be these 2 banks. Will they be those 2 banks which are not really doing well at this moment and are actually struggling, or will the government actually go ahead and
be bold enough to privatize? Right.
Yeah, but by the indications of it, it will not be those big banks which are doing well. It will be one of the smaller ones.
So the next question was, will it happen? Because this takes forever. As you mentioned, these are very politically sensitive issues. There are hurdles all the time. What is the time frame?
Our time frame, according to the government, next year. See, a few interesting milestones in terms of how this will happen. First is they'll have to amend the Bank Nationalization Act. So that will come up in Parliament as per the FM in this session itself. Given the kind of numbers that they have, the government has right now, possibly the government is able to push through the nationalization in both Rajya Sabha and Lok Sabha. So far, it's always been the numbers in the Rajya Sabha which have been a problem for the government to push through this kind of a number. Yes, so in terms of, first will be the amendment to the Act. The next would be, the whole process of the sale and handling the bank unions. Process of sale, again, it will depend on which bank is offered. If it's a bank which is already struggling, posting losses, having a big bad debt book, may not find those many buyers. But again, if it's a bank, which is doing well, possibly. Again, it will depend on, what kind of regulations that the Reserve Bank of India comes out with in terms of if it will allow a big corporate house to pick up a bank, pick up stake in a bank. Then even, if a corporate house has a lot of money, it may not really mind picking up even a bank which is not doing well, because as long as, they're able to get a foothold into the banking industry. So there are many things that will, it will depend on many things on how exactly this will happen going forward.
Right.
And what is the last question?
Well, the last question was the impact on economy and on people. So, there is a school of thought which is not very pro privatization and disinvestment.
True. If you would look at what happened when the Atal Bihari Vajpayee government actually went ahead and did privatization, if you would look at how these firms which are actually sold off or in which the government mostly exited have done, most of these firms have done really well once they were privatized in terms of, they're much more profitable now, they're much more bigger businesses now because the government exited, like firms like Maruti Suzuki, Hindustan Zinc, Balco. So these are firms in which the government has done, these firms have done well once the government exited. Eventually, the government should not be in every sector, right? It should be present in strategic sectors, as they have said. The 4 strategic sectors that they have pointed out would be, they've talked about banking, insurance, they talked about defense, they've talked about power, coal. So there are some strategic sectors where the government should be present, but should it be really present in all sectors may not really be the case.
Yeah.
It should not really happen here.
So, Abantika, I'll close with you. What is the one thing on the health front that you wish to see in this budget, but which wasn't there? Or anything you feel that the finance minister could have added to make it a more holistic approach towards the health sector?
I think Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, it was launched in September 2018.
Right.
And it has, it was, at that point of time, it was touted as the world's largest government-funded health insurance program. But it has so far seen quite poor enrollment. It's just 13.5 crore people have been enrolled. So what I would have liked to see really is how do you plan to push that up, and maybe even expand. But expansion is, I think, way too ambitious at this stage. But how do you plan to reach, and how and when do you plan to reach that number of 50 crore? Because till you reach that number, there is also, it's, an insurance program, it thrives on numbers. If your numbers are still so low, I can understand that 2020 was almost wasted. There was no door-to-door enrollment, nothing could have happened. But I think somewhere PMJ it's probably no longer that kind of a priority anymore that it used to be. Last year it was 6,400 crore. This year again it's 6,400 crore. So clearly it's not picking up pace the way it should be, and it's a very good program in terms of, because that to my mind is the first step towards universal health coverage. If that is not taking off properly, then where are we on universal health coverage?
Right. Well, an important budget for the government, as I mentioned, coming at a difficult time. The pandemic, of course, has slowed the economy down. So there was a lot of attention that was being paid to this budget. And fortunately, we've had 2 domain experts, in-house domain experts, who managed to sort of clear the fog a little bit and explain what the budget means on account of health, on account of COVID, and of course on other accounts, as Remya explained. Thank you so much for watching Government Matters. We also had a special edition of Ilanomics earlier, where our managing editor YP Rajesh was in conversation with economist Ila Patnaik. So that's available on our YouTube channel as well. You should watch that as well. That was a very, very informed discussion. Thank you so much for watching Government Matters, for sending in your questions. Do keep subscribing to our YouTube channel and log on to our website today. We have lots more stories from the budget.